Good morning. This is Dr. Kordestani. I'm here with you from the Ward Institute. So today we're going to be talking about a very common procedure that's gained a lot of traction, both in the cosmetic world and in the world in general. That is the Brazilian butt lift. So what is a Brazilian butt lift? That's a great question. A Brazilian butt lift is a surgical procedure with the intent of taking fat from different parts of your body and actually putting it into the buttocks area or the hip dip area. So the reasoning for this is because a lot of patients actually do have excess fat, different areas, abdomen, chest, back, thighs, but where they don't have any fat and don't have any projection is in the buttocks area, and that's very common. Certain populations tend to have a preferred anatomy, so they actually have a nice buttocks area, and most of the population doesn't. So it's unfortunate, but it is correctable. That's nothing wrong with somebody who doesn't have a very big buttocks area. However, it's one of those things that if in fact you wish and wanted one, you could ask Santa for it. So main thing is, in surgery, what we can do is take the traditional liposuctioning, take fat from different areas of the body, and what we used to do traditionally is to discard or throw that fat away. Now, with the better techniques that we have, we can actually put that through a filtration system, thin and clean that fat so it's viable and better and healthier, and actually use that fat to inject into the buttocks area and the hip dip area. And then that tends to give you a much more of a contoured look. Now, the next question that usually comes up is, how do I know if I'm a candidate? That's a great question. A lot of people are candidates, some aren't. The best way to really know is to actually come in, sit down with us in a very low stress environment and really take a look at it and see if in fact you're a candidate. A significant number of people are candidates. Some have contraindications, and those are just our concerns for the surgery, the actual procedure. And in many cases, when we actually sit down and send the patient back over to their primary care physician, with a little bit of fine tuning, those patients are ready to go. So the number of patients who actually are candidates is significantly large. Other things that do come across, how much does it cost? It all depends how many areas we're going to lipocontour, what we're going to actually have to do, how much fat we have to put in. Now, how about the recovery? Another great question. The recovery actually is fairly short. What we want to do is make sure that you're a good candidate, you go through the procedure safely, we'll put the fat in, and the fat that we put in is good quality fat, and the fat survives. Sometimes we have to redo this. For example, you'll see some of the movie actresses or some of the actresses that are on social media, they've actually gone through this procedure 5-6 times. They, of course, don't let you know that. It looks like picture 1 and picture 2. They don't let you know that they've had 4 or 5 sets of fat grafting. So it's a little bit misleading. But many patients, usually within 1 and 2 procedures, get a nice overall projection, get rid of the hip dip area, and are very satisfied. Just so that you know, as opposed to things like fillers, fat graft is here to stay because it lives forever. It's part of yours, and it tends to last long term. I would suggest for you guys to come and see us. Again, we're at the Ward Institute. We'd be happy to see you, and let's see if a BBL or a fat grafting is the ideal answer for you.